we're going to do the breast exam and teach, and we're just going to do it over clothes, just a couple of strips. But we do want you to know this. So this is the triple touch method, and the best time to assess your breast for lumps is a few days after your period is over, like the week after your period's over. And you can do it in the shower, and you can also do it lying down, preferably lying down. Make sure you include that. And you're going to look in the mirror, the arms above your head, okay, and arms at your side, and then like this, pressing in, and then leaning over. And you're looking for dimpling or pulling, and that your breast should hang freely when you're leaning over like this. Also inspect for skin changes, and if you're 40 and over, you should have a mammogram once a year. And now we're going to let her lie back. You'll have a towel, put that under her shoulder and put this. And we're going to use 3 fingers, 3 different levels, okay, to assess for breast masses. And I want you to do this on yourself also. And you start in the mid-axillary region. Go light, moderate, and deep. And go over an inch, light, moderate, and deep. It's in a circular motion. Light, moderate, and deep. And when you get to the deep palpation, it's probably going to be a little uncomfortable. Okay. And you only go to the brow line, and then you move up one. So if y'all will do at least 2 strips for us, okay? And go all the way up to the clavicle. Go all the way across, and then you have her switch arms. Go all the way over to the other mid-axillary line. And you just cover the whole sternum and go back over to the... So you've got one big rectangle of space you've covered. All right? Now, when you guys, if your partner's a guy, you do it on a guy too. I also would have, looked at the areola and the nipple for any lesions, or any changes. Yeah, you just say I've looked at what you're going to look for and look at, because they got their clothes on, so I'm not going to make you bare. All right. Now I need to do the lymph nodes. So this is right under her pec is anterior, right very middle is central, right underneath her trapezius back here is posterior, and right here is brachial or lateral. And then I believe epitrochlear is also on there. Is it? No? Okay, epitrochlear is right here. And her posterior chest, it's, I've already mentioned that her chest is symmetric. Any tenderness? Don't palpate her spine, that it's straight, because this is part of the musculoskeletal. So there's no tenderness to her paravertebral muscles. And I'm going to check for CVA tenderness. Remember how to do that? Does that hurt? That's one I always leave out. I lose points for that one. All right. Now, the next one is abdomen. So I'll let you lay back down. So I'm just moving down the body. We did the lungs at midterm, so we don't have to do that again. We didn't do abdomen, so we have to do that. First thing is inspection. I look at the contour, that it's flat, it's not scaphoid or distended. I look for any scars, any changes in the skin, any pulsations, any peristaltic waves, any masses. I also look at the umbilicus, look for any body jewelry, look for any signs and symptoms of infection. That's inspection. The next is auscultation, so I'm going to use my stethoscope. Stethoscope the skin, listen in each quadrant for bowel sounds. Should be 5 to 35 per minute. And I don't have my stethoscope, so we'll just pretend, but y'all do it for real.
Do we need to listen for the full minute?
No, just until you hear them. Okay. Yeah, just until you hear them. And then you can say bowel sounds are present in all 4 quadrants. Also auscultating over the aorta and the epigastric area. I don't hear any bruise. I auscultate with my bell. Remember, you got to flip over to your bell now because you're going to listen to bruise now. Listen over the renal arteries, no bruise. Listen over the iliac arteries, no bruise. Listen over the femoral arteries, no bruise. And I don't think on there it says to listen for a venous hum on the liver, does it? Does it say that? No, okay. So you don't have to do that. So I've auscultated, I've inspected, auscultated. I'm going to percuss now, so I'm going to do general percussion, all 4 quadrants. Okay, so general tympani, and then I'm going to percuss the liver span. So I'm going to start at the level of the umbilicus at the midclavicular line and move up. Did y'all tell the difference? And so I'm going to put the lower border with my pen. I'm going to mark right here. And then I'm going to start just under the breast. No, that's resonant. So I know I'm above the top of the liver there. That was good. That's still resonant. It's getting higher. So I'm going to say the top of the liver is right there. So put my top mark there. And then I measure. Yeah, your partner has it easy. It's not that easy on everybody. So I would measure from here to here with my tape measure. And I should get, what? You remember that? 6 to 12 at the midclavicular line. Okay. And I don't believe percussion of the spleen is on there, is it, by chance? No. Okay. All right, so we've inspected auscultation, auscultated percuss. Now I got to palpate all 4 quadrants. And I'm watching her face, see if it's tender, if she's grimacing any, feeling for masses. You want to take your time, make sure you've covered all 4 quadrants quite well. Palpate over the bladder, around the umbilicus. Take a deep breath. Let out. Checking the liver. If you'll notice, there's no special test on this. Like, you don't have to say, I'm doing the Murphy sign. There's no the only special tests, I think, are the Kernigs and Brzezinski's on this thing. And I'm going to check the spleen. Deep breath. Let out. And I don't believe it's, and I can't palpate her liver or spleen. I don't believe there's palpate kidneys on there, is there? Okay. Okay, so how about inguinal lymphadenopathy? Is that on there? Or inguinal femoral pulses?
Yes.
Okay, so there's no lymphadenopathy, and I'm going to feel that femoral pulses are equal. They're nice and strong. So I'm not expecting she has coarctation of the aorta because she has great femoral pulses. Okay. And, okay, thanks. So I got 2 points off to that, however many it was. Aortic width. So you want to find it and just try to capture, feel the edge on one side. I would take my tape measure and measure it. It's probably about 2 cms on her. Normal is 3 cms. Hers is really easy to palpate. Most folks, I tend to find it's a little more to the patient's left side. It doesn't seem to be perfectly in the middle. It tends to be a little over to their left. And next is the hip. There's no guarding, rigidity. See, I need to say that. I might get points counted off. Okay. Like I said, I never make 100 on this, even though I've done it 90 times. You know, you'll usually forget something, but it's pretty tough to miss so many things if you practice a lot to make a 4th grade. All right. Since she's lying down, I could go ahead and do the Babinski so you all can see it. I'm going to do her lower extremities now, and so we're going to do 1 foot, and you go up the side and across like that. She's not real ticklish. Are you a little ticklish? Like that. So most people go like that, you know, because they can't stand it. In a comatose patient, you'll see the neurologist take this like this or their fingernail and just dig it right up and across. Try to get a response from them, and they'll watch their face too, to see if they're going to curl or fan and see if they react with the grimace to the pain. So that's Babinski. So she went a little bit like that.